Welcome to my research presentation. The topic of this presentation is supporting students with anxiety in the classroom. I chose this topic because my role within my school is to support students with severe mental health and anxiety issues. Often this is done off-site with a view to integrating students back into the school and classroom environments. Child and youth mental health problems can generally be classified into two categories: internalising and externalising symptoms and problems. Anxiety disorders and their symptoms fit into the internalising category. Anxiety disorders are the most common mental health disorders in childhood and adolescence, with an incidence rate of between 9 and 32% throughout these years. Anxiety's feeling is associated with feelings of anxiousness, excessive worries, fears and negative beliefs, as well as physiological symptoms such as stomach aches, headaches and rapid heart rate. Anxiety disorders are often comorbid with other mental health disorders such as depression. Students suffering anxiety will often have difficulty maintaining regular academic process and may require educational supports that assist in developing social skills, self-awareness and self-regulation and self-control. According to the Beyond Blue website, the 6 most common anxiety disorders seen in primary school students are generalised anxiety disorder, separation anxiety disorder, social anxiety or social phobia, phobia of specific objects, situations or events such as injections or spiders that bring about extreme fear and avoidance even though the threat of harm is small, obsessive compulsive disorder and post-traumatic stress disorder. The characteristics and symptoms of anxiety disorders can be broken into 3 categories and can impact students in the classroom in the following ways: cognitive, the influence on thoughts and thought processes, including concentration and memory problems; oversensitivity, worry, problem-solving difficulties, cognitive dysfunctions such as that with verbal recall and listening. Physical symptoms include headaches, recurrent localized pain, rapid heart rate, nausea, vomiting and tics. This can impact students' attendance to school. Behavioural symptoms include task avoidance, restlessness, erratic behaviour, perfectionism, lack of participation and failure to complete tasks, all impacting the student's learning. With the average onset age for mental health disorders being childhood and adolescence, schools are a valuable setting for positive mental health promotion. Schools and teachers can support students with anxiety through the development of whole school and classroom programs and the implementation of classroom practices and strategies that support positive mental health, including students with mental health issues and anxiety disorders. When mental health and wellbeing programs are integrated into the whole school community, it creates a positive emotional climate for learning and destigmatises mental health. Students feel more supported, increasing student participation and academic outcomes. Whole school programs that support classroom practices include the Mentally Healthy Schools Framework, Kids Matter, a support for students in primary schools, Mind Matters for secondary schools, and multi-tiered systems of support. A multi-tiered system of support can be used as a whole school program that supports classroom strategies and practices, including classroom management, instruction and support for students with anxiety and mental health issues. A multi-tiered system of support strategy has 3 tiers. Tier 1 is the prevention using universal interventions for all students. It includes comprehensive classroom management and behaviour management plans with high academic and behaviour expectations, student-focused teaching and learning approaches. Tier 2 consists of secondary interventions used for some students who require support. It targets small group explicit teaching with the instruction of social skills to small groups, peer-assisted learning strategies, and class-wide peer tutoring. Tier 3 are tertiary interventions for individual students and are intensive interventions. These may include crisis counselling, individual support and behaviour management plans, and specific classroom accommodations for individuals. While there are many strategies, programs and practices that teachers can implement to support students with anxiety, mental health and other emotional and behavioural disorders, creating a positive classroom environment is fundamental in providing an inclusive, welcoming place where all students feel safe and that they belong. Features of a positive classroom environment include a warm and inviting physical environment in which students can focus on learning, getting to know your students and their individual needs and requirements, reciprocal relationships based on mutual trust and respect, high behavioural expectations with rules and procedures prominently displayed and consistently referred to, the encouragement of self-directed student learning, and providing learning experiences based on student interest and ability, therefore promoting active engagement of learning. Thank you.